Now, using a limb shouldn't really require active thought. You think about picking up something, the mind relays that message to your arm muscles, and your arms pick it up. Now, prosthetics have come a long way in the last few decades, but they've also gotten incredibly complex. Now, E-Redi, a brand new prosthetic arm produced in Mexico, is trying to change that. It has just one muscle sensor, but that allows it to do pretty much anything that an arm would. Simplicity is key, folks.
Technology has always evolved to solve human limitations. From simple tools to advanced machines, each step has made tasks easier, faster, and more accessible. But when it comes to prosthetics, complexity still remains a challenge. In Mexico, researchers are working on a different approach, a prosthetic arm that focuses not on adding more, but on simplifying what already exists. The device is called E-Redi. Developed at the University of Guadalajara, it is designed to reduce the difficulty that often leads users to stop using prosthetic devices.
Lo explicamos a través de esto.
We explain it this way. An arm that can be used by anyone who is missing a limb, whether amputees or people with congenital malformations. And what's more, the adaptation process far surpasses other arms on the market that require large electronic components to function. Our E-Redi device is so simple that with a single muscle sensor, you can control different prosthetic levels, which helps ensure the device is easily adapted and accepted by our future users.
La aceptación del dispositivo sea ampliamente utilizada por nuestros futuros usuarios.
Traditional systems can require multiple sensors, bulky hardware, and long training periods. For many users, that becomes a barrier. E-Redi takes a different route. It uses a single muscle sensor to control different levels of movement, reducing the need for multiple electrodes and complex calibration. The result is a system that is easier to learn and quicker to adapt.
So, if someone suddenly arrives and tries to adapt a prosthetic device, learning how to do that takes time. E-Redi aims to make a quick adaptation that can help people quickly get used to using their prosthetic device.
The arm is designed for amputees as well as individuals with congenital limb conditions. Control is based on muscle signals, allowing users to train their movements over time. This process relies on neuroplasticity, where the brain learns and adapts, improving control with continued use. But simplifying the system required a complete rethink. Most prosthetics depend on multiple inputs to function. Reducing that to a single sensor meant reworking both design and functionality.
Cualquier prótesis, ahora sí que me parece impresionante.
Any prosthesis now I find truly impressive, especially coming from my best friend who made it with so much love and dedication. But yes, it was a fairly limited prosthesis in terms of movement and things like that. And now, with all the advancements that have been made, I feel it's on par with many others on the market.
The final device is compact and self-contained. The arm is 3D printed, with motors and batteries built into the forearm. Earlier, models often required external harness systems and multiple electrodes attached to the body. This design eliminates that, making the device cleaner, lighter, and more practical for daily use. The development is still ongoing. Future versions are expected to include voice-enabled controls.
Currently, our device is controlled through muscle signals, and we are a few steps away from being able to integrate this part of the voice commands and muscle activity, but we are very close to being able to achieve it.
Combining muscle signals with voice input to enable more complex movements, expanding capability without adding complexity.
En un principio, yo pensé que el mayor reto iba a ser...
At first I thought the biggest challenge would be learning to move it, maybe dealing with the space or the weight. But no, that's been the least of the challenges I've faced. Right now, I feel the biggest challenge is the psychological aspect, the mental aspect, the adaptation, suddenly having to take the prosthesis off because I'm tired or because it's going to get too heavy or whatever, right?
The goal is clear. Make prosthetics easier to use because in many cases, the problem is not the technology, it is how difficult it is to live with it.